Wes here from Rare Patient Voice. We were talking with a client this week, and she made a good point. Our client mentioned that when they plan on using Rare Patient Voice patients in a project and are competing for business with their client will come back and say, well, your competitor's only charging $10 per recruit and you're charging $40. And she said she tells them why Rare Patient Voice is actually the better value. We recruit in person at patient events, so we know the patients are authentic. And since we've met them, they have a high response rate. Our patients help us recruit others from their support groups, advocacy groups, and families. We pay by check to help ensure they aren't frauds. A person anywhere in the world can get 100 Gmail addresses in minutes, but paying with old-fashioned paper checks to actual brick and mortar addresses, we're assured these are individuals and we know where they are. Based on this testimony, think of RPV not only for Rare Patient Voice, but for really positive value. Who remembers the old Fram oil filter ads? You can pay me now or pay me later. Take a look. The idea is pay a little now for an oil filter and avoid hundreds of dollars later in engine repair. Same with our sample. Pay a little more for authentic patient sample and avoid refielding a study where they aren't real. And avoid losing a client for the next project because this one went south due to bad sample. And even more, have your client avoid making the wrong $1 million or more marketing decision because their research was based on fraudulent sample. So think RPV, really positive value, and take a trip back down memory lane with the old Fram ad. Thanks.